So in a breast reduction consultations, I normally have at least 2 and sometimes more sessions of one-on-one, each 60 minutes. Now in these consultations, I really try and get to know or explore why the patients come to see me. In fact, my very first question to every single patient is why now? Because breast reduction has so much benefits. It's one of those surgeries that usually 1 week after surgery, the patient shows up and big smile on their faces, sometimes tears of joy because they waited so long to do it. So I really try and explore what took them so long. And the consultation, of course, will go through the normal medical history, do some general examination measurements, explore what they desire to be, what really bothers them, and what they think the results are. Then we start to discuss the surgery, techniques involved, what sort of scars would they get, how we manage those scars, what are realistic sort of results, what are some of the results that may not be achievable. We'll explore all that, so that way our expectations are equal or close. And then I like to go through the experience with the patients because I try to picture myself in their shoes. You know, coming to the hospital, when you wake up in recovery, the very next morning when I come and I try to fit you into a bra that fits you well, and what are the dressings like, the medications you might be on, such as antibiotics, and we make sure we give you some analgesia. I try to cover all those steps so nothing is unfamiliar when you come to the hospital, and I'd like to make sure you're well prepared. Now, I would touch on some of the complications and risks, but I normally like to spend another whole session on that. And so we'll go through possible risks and complications of the surgery as well. During this time, I usually show them my before and afters, so I show them some of my galleries and try to address some of the questions. Usually, I try to let the patient have a bit of time asking what they didn't understand, so that by the time we do get to the surgery, there's usually no unknowns. Everything has been explored.